Hello, everybody. First of all, thank you all, especially the organizers. And I wanted to start with a heartfelt feeling. I am a social worker. I am feeling inspired by some of your work, and so I am very excited to also be able to go back to school tomorrow to share some of those ideas with my administrator and district. I'm here to talk about our student support services. First, how do you? Oh,
yeah, that one will push it forward.
Sorry. Okay, so I am a school site social worker, and what you should know is that our district is small but mighty. So we actually have a school site social worker at every site, all 9 schools. And this team, as we see it now, that's my team, that's our holiday picture, was established in 2013, and the way we were able to afford that was through the local control funding formula, and that allowed us to be able to put money directly into mental health. And our team consists of 1 district social worker, 8 school site social workers who each have 5 to 10 social work or MFT interns, 1 Medi-Cal outreach liaison, and 8 community liaisons. The Medi-Cal liaisons, I will go into what school site social workers do, but our Medi-Cal liaison actually dedicates herself to connecting families to Medi-Cal. What we were finding were that a lot of families were open to, some families were open to services but didn't have the Medi-Cal needed, so we were able to collaborate with a neighboring hospital, Providence, who helped us train someone to connect someone to Medi-Cal, to connect families to Medi-Cal. Our community liaisons dedicate themselves to parent engagement. So they're the ones who are connecting to community resources so that we're able to provide parent workshops and parent initiatives and increase parent engagements through PTA throughout the school year. So one of the questions I get is, at what point did your district decide that they needed to have school site social workers? And what happened was that district-wide surveys continued to show that teachers and families really wanted more mental health services. And so that aligns with some of the national feedback that was shared earlier today. And in addition to that, we started looking at the full integration of multi-tier systems of support, and it became more clear that without social, emotional, and behavior, or people who are really trained in social, emotional, and behavioral well-being, it would be really hard to implement multi-tiered systems of support to fidelity. So specific to Rogers Middle School, our demographics are mostly Latino, with about 74% of our students being Latino, African American, Asian, white, and other. We have about 1,000 students, give and take throughout the school year. Students and families are low to middle socioeconomic status, and about 80% are eligible for free and reduced lunch. Currently, our other at-risk populations that we're working with are homeless, about 26 families at Rogers specifically. Our newcomer populations, which consist of kiddos who have recently moved here from other countries, consist of kids who have lived in Guatemala, El Salvador, Morocco, Egypt, just to name a few. The other at-risk population that we're serving is our LGBTQI plus youth. The most prevalent issues that we face are trauma and adjustment to change. Specifically, if I'm able to think about the students that I work with, most of them have, to some extent, exposure to violence, which kind of aligns with what most of us are saying, sexual and physical abuse, and that manifests in different ways. So in some students that manifest with anxiety, depression. Some students have ADHD. We're seeing self-harm and suicidality at higher rates, threats to others, drug use, specifically e-cigarette, and misuse of prescription drugs, verbal and physical aggression, bullying, and cyberbullying. So I'm really proud of my team. There's 9 interns at my school site, 5 are pictured here. What's different about my position versus maybe a school counselor's position or maybe school site social worker positions in the past is that I have more of a managerial position. So I am not providing direct services as often as I used to when I worked at an outpatient clinic. I'm managing a team of interns and training them so that they're able to provide ongoing counseling services. I'm supporting PBIS implementation. Something I'm really excited about is professional development. What we're finding is that although teachers were open to the idea of having more social work support and social emotional learning, they're like, what does that mean? What does it mean to integrate social emotional learning in my classroom every day? How do I talk about feelings? How do I encourage good decision making and conflict resolution and empathy? And so what we have started this year is a series of trainings, and we have a 3-year plan. We are training our teachers about trauma, about ACEs, about recognizing trauma, realizing the impact of trauma, responding to challenging behaviors, implicit bias, restorative practices, community circles, and something that I think is very important is also self-care. And so oftentimes we want to think of a social worker as someone who's there to support the child, but the more I'm in a school, the more I realize that the adults also need support. They're not going to be able to support our kiddos if they themselves are stressed out or burned out. I'm part of the MTSS team. I, for the most part, am the one to take on the more high-risk issues, so risk assessments and crisis management. So if there's a student who is displaying suicidality or has shown any signs of wanting to hurt other people, we prioritize that and assess for risk right away, and we keep track of data. So similar to my colleague, we also apply the 3-tiered approach. Because we don't see our job as just meeting with students. We're looking at how to shift school culture and applying a paradigm shift. So we're supporting students at every level. As you can see, this isn't to the T, I wouldn't say 80% of general population is receiving our tier 1 or tier 3 as it's shown here, but we are doing things that affect the whole school. So class lessons, using the evidence-based second step curriculum. We're supporting PBIS. We're providing our teacher trainings. We're providing enrichment activities that go beyond mental health services. For example, last year we started an expressive arts program that culminated into an art showcase to promote mental health awareness. Parent workshops. Our at-risk students are receiving short-term counseling, group counseling, restorative conflict mediation, which goes beyond just student to student. We're also creating spaces for teachers and students to be able to talk to each other, and we're providing individual counseling, crisis management, and attendance counseling to our top 5% of kids who are displaying high risk, meaning their functioning is impaired, they're not really able to function in a class setting without the support. So just some pictures showing some of our some of our initiatives, Alliance Club was a GSA LGBTQI plus club that we started last year. We celebrate Mental Health Awareness Month in May, and a picture of the students that participated in our expressive arts program. Lastly, and to end, there's so much more to this program, but the truth is that this couldn't have been done without the support of our leadership from the very beginning, superintendent, director, student. I'm just here on behalf of them, but I wouldn't be here, I wouldn't even have this position without their support and without the partnerships that we've been able to cultivate in our community. So we've been able to cultivate these relationships with USC, Loyola Marymount, Cal State, Dominguez Hills, and it's because of that that I'm able to say that I'm able to connect students to counseling services, and if there is a student that needs mental health services, they're going to receive it, as long as there's parent consent. We also partner with our mental health agencies, our hospital. Vision to Learn is donating over 300 glasses to our students. PS Arts comes every week to provide art intervention. So it definitely, I think, I'm proud because I always say it takes a village, and it's possible. It's possible to be able to provide mental health services. It just takes a village. Thank you.
In the spirit of the village, we're going to hear from one more important sector. We've heard a lot from sectors that have strong ties to the municipal systems, but community-based organizations also play a critical role. So we're going to hear now from Erica Lewison, who's the manager of community impact in the area of education at the United Way within the capital area. And United Way plays a key role in many communities in terms of partnering with school systems. And then we're going to hear from Tabiti Gibson, who is from the Restorative Justice, he's the Restorative Justice Coordinator at the Edna Brewer Middle School in Oakland. So looking forward to hearing from both of you.